Today's topic is routes of drug administration.
We normally classify these routes into three categories: enteral route, parenteral route, and other routes or the miscellaneous routes. Mind you, all these routes have certain advantages and disadvantages. Enteral route. Enteral route involves the administration of drug via the GI tract or the alimentary canal. It is further subdivided into oral, rectal, and sublingual routes. Or we can say that both ends of the GIT are utilized. Sublingual route refers to the route of drug administration by which the drug diffuses into the blood through the mucosal lining under the tongue. The term transmucosal means a route in which the drug is diffused through the mucous membranes. Parenteral route. It is a non-oral means of drug administration, generally relating to injecting a drug into the body, bypassing mucous membranes and GIT. Examples include intravenous route, in which the drug is directly placed into the systemic circulation using a direct IV push or IV bolus, and slow IV infusions, of course. Intramuscular route involves injections made into the deltoid muscle of the arm and the dorsogluteal muscle of the buttocks. Intradermal route. It is a shallow injection into the dermis, which is skin layer underneath the epidermis. Subcutaneous route. In this route, the drug is injected into the subcutaneous tissue, which is made up of fat and connective tissue and lies under the dermis. Intra-articular injections, where the needle is inserted into the joint space and the drug is delivered locally into the joint. Intrathecal route, in which the drug is injected into the subarachnoid space so that it reaches the cerebrospinal fluid. This route is often used in spinal anesthesia. There are some other commonly used routes of drug administration which include transdermal route. In this route, the drug is delivered across the skin for systemic distribution, such as the use of transdermal patches. Inhalation route. By this route, the drug is inhaled or is administered into the lungs for the management of respiratory diseases such as asthma or COPD. Nasal route, where the drug is insufflated through the nose for topical or systemic actions. Intravaginal route, where the drug is applied to the vaginal mucous membrane for local or systemic effects. We have ocular or ophthalmic route, which means administration of drug to the eye. Otic route, in which solutions are applied to the outer ear canal for local action. So this was our topic for today. Thanks for watching, and I will see you again soon. Till then, bye-bye.